From WQAD News 8, this is News 8 This Week with Jim Mertens.
Hi, everyone. Thanks for joining us virtually today. We'll start it off with Governor Pritzker and then go to Dr. Ezike and then take your questions. Governor?
Great. Thank you, everyone. Thanks for joining. Good afternoon and welcome to today's COVID-19 update briefing. As you can see, I'm following CDC and IDPH guidance and quarantining after a member of my staff tested positive for COVID-19 early on Monday. There are a few other close contacts of this staffer, and each of us will be in quarantine until October 12th. That's the 14-day period that's recommended by public health officials as a precautionary measure. At this point, I and every member of my team who comes into the governor's office tested negative in an office-wide check Monday afternoon. I spoke with the staffer who tested positive, and they have some symptoms but are in good condition and resting at home. Let me take this opportunity to remind everyone that there is testing available to literally every person in Illinois, whether you've potentially been in contact with a COVID-19 case, if you're feeling unwell, if you just want to check in, you're able to get a test at no cost. You don't need insurance, you don't need to be a citizen, you don't need symptoms, and in most places, you don't need an appointment. You can find the state-run testing site closest to you, as well as a list of the hundreds of private and commercial testing sites across the state at dph.illinois.gov/testing. Again, dph.illinois.gov/testing. On to our COVID-19 update for the state. Over the last 2 weeks, 9 of our 11 regions have seen their average positivity rates decline, even as our state is performing tests at record numbers. That is really good news. Not every region is succeeding to the extent that we need. Unfortunately, yesterday, my administration announced that because it has surpassed 8% positivity for 3 days in a row, starting this Saturday, Region 1, home to Rockford and Dixon and Galena, will need to adhere to the COVID-19 resurgence mitigations. Those are the same ones that are currently applied to Region 4. IDPH has been in conversation with county health departments to discuss preventative measures that they can take at the local level. Region 1's concerning uptick in positivity, jumping more than 2 percentage points in 2 weeks, demands increased focus on stopping the spread. In the past week, Region 1 also has had an early indication of increasing hospital admissions for COVID-like illness. Although this increase has not yet reached the threshold level, it does indicate an increasing seriousness of the illness caused by the virus, so we're watching that closely too. Like the other regions that have exceeded 8% positivity, Tier 1 mitigations will be temporarily imposed, including all bars, restaurants, gaming facilities, and casinos will close at 11 p.m. All indoor bar service and indoor dining will be closed. Outdoor bars and dining may offer table service if they follow tightened mitigations, including that all patrons must remain seated and that reservations will be required for every party. Party bus services must temporarily close, and gathering limits will shrink to the lesser of 25 individuals or 25% of overall capacity in other locations. In the coming days and weeks, depending on whether we can slow the infection rate in Region 1, these mitigation measures could be removed. They could be maintained or even strengthened. To a large extent, the path forward will be up to the residents of Region 1. I encourage everyone to wear your masks, encourage others to wear their masks, watch your distance, and wash your hands. And if we all put our public health first, there will be fewer infections, and that means fewer restrictions and quicker return to normalcy. As has been the case, the average positivity rate over a 14-day period starting this Saturday will be the indicator. If the region gets itself below 6.5% for 3 days in a row, the new mitigations will be lifted and the whole area will return to the current phase 4 mitigations under the Restore Illinois plan. These rules are not meant to be a punishment, and I don't particularly enjoy having to deploy them. But we have got to keep people healthy and safe. The vast majority of our Restore Illinois regions, that's 9 of 11, so far have not required additional mitigations. 8 of 11 have not required additional mitigations since all of the state reached the current phase of our reopening plan in late June. That's nearly 3 months to the day. We all want to have our schools and our businesses open, and we can do that by keeping community spread low and infections down. Illinoisans are proving that we can do that, and they're proving it every single day. So thank you, and with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you so much, Governor. I will start with the case and test updates. Today, we are reporting 2,273 new cases of COVID-19 and unfortunately 35 deaths. In Illinois, we have now seen a total of 293,274 cases and 8,672 lives lost. 1,632 individuals across Illinois were reported to be in the hospital overnight with COVID-19. Of those, 378 were in the ICU and 152 were on ventilators. In the last 24 hours, more than 58,000 lab tests were reported for a total of more than 5.6 million tests. We are seeing some good trends, like in Region 7, which was able to move to phase 4 of Restore Illinois after implementing additional mitigation. But as the governor mentioned, we've also seen some troubling trends. In Region 6, which includes the University of Illinois at Urbana-Champaign, IDPH has been carefully examining the data. This is a really unique situation where repeated saliva testing for staff and students at the Urbana-Champaign campus results in a tremendous number of tests, up to 20% of all the tests done in the entire state. So while that region with those saliva tests is seeing a test positivity rate in the 2s, without Champaign County and those Urbana-Champaign tests, that rate skyrockets to over 7%. We want to ensure that the large volume of tests at Urbana-Champaign does not overshadow the trends that we're seeing in the broader region. And we don't want to be inhibited from taking action to keep people safe. Therefore, in addition to providing data for Region 6, IDPH is now presenting data for Region 6 without Champaign County's numbers. If regional metrics are tripped in Region 6 by looking at the data in this way, the entire region, including Champaign County, will still be required to implement mitigation efforts. IDPH is in contact with local health departments and community leaders in the region and is encouraging them to begin taking action right now to reduce the test positivity rate. As we enter fall and winter holiday seasons, IDPH is committed to ensuring our communities have the best public health guidance to stay safe. Today, IDPH released guidance for Halloween, which can be found on the IDPH website on the COVID-19 page under guidance. For Halloween, we are encouraging people to find ways to celebrate that might look a little different than in years past, but we still allow our children to take part in these festivities. Trick-or-treating could now involve just setting out individually wrapped pieces of candy spaced out on a table where kids in costumes socially distanced can still pass by and retrieve it. Activities like hay rides, pumpkin patches, orchard visits are allowed with limited capacity, masking, and social distancing. For anyone wearing a costume, whether a child or an adult, a costume mask is not a substitute for face covering. If face coverings are worn under the costume mask, please ensure that this does not create any breathing problems. And if it does, don't discard your face covering, put the costume mask aside. Haunted houses are not permitted under Phase 4 of Restore Illinois. We are also asking adults to avoid crowded costume parties at home or at bars, which can absolutely increase your risk of getting COVID-19 and spreading it in the community. These are unprecedented times, difficult times, but I encourage people to accept the situation, but try to be creative this holiday season. Challenge yourself and your kids on how you can celebrate these holidays as safely as possible. Keep washing your hands, keep watching your distance, and keep wearing your mask. And of course, Get your flu shot before the end of this new month coming October. The sooner the better. And now the comments in Spanish. Muchas gracias por su liderazgo, Gobernador Pritzker, durante estos tiempos sin precedentes. Hoy, el Departamento de Salud Pública de Illinois reporta 2,273 nuevos casos de COVID-19 y también 35 muertes. En Illinois hemos visto un total de 293,274 casos y 8,672 vidas perdidas. 1,632 personas en Illinois pasaron la noche en el hospital con COVID-19. De ellos, 378 pacientes estaban en la unidad de cuidados intensivos y 152 pacientes estaban en ventiladores. En las últimas 24 horas se informaron más de 58,000 pruebas de laboratorio fueron hechas. Estamos viendo algunos buenos cursos, como en la región 7, que pudo pasar a la fase 4 de restaurar Illinois después de implementar mitigaciones adicionales. Pero también estamos viendo algunos cursos que nos preocupan. Aumentos en la región 1 y la región 6. En la región 6, que incluye la Universidad de Illinois en Urbana-Champaign, IDPH está examinando los datos. Esta es una situación única en la que las pruebas repetidas de saliva para el personal y los estudiantes dando resultados de una gran cantidad de pruebas, hasta el 20% de todas las pruebas realizadas en el estado. Si bien la región está experimentando una tasa de positividad promedio de 7 días de 2%, sin el condado de Champaign, esa tasa se dispara al 7.2%. Queremos asegurarnos de que el gran volumen de pruebas de la universidad no eclipsa el aumento que estamos viendo en la región. Por lo tanto, además de proporcionar datos para la región 6, IDPH ahora presenta datos para la región 6 sin el condado de Champaign. Si las métricas regionales se disparan en la región 6 con estos datos, toda la región, incluido el condado de Champaign, aún deberá implementar esfuerzos de mitigación. IDPH está en contacto con los departamentos de salud locales y los líderes comunitarios en la región. Van a comenzar a tomar medidas ahora mismo para reducir la tasa de positividad en las pruebas. Ahora que ha llegado el otoño y el clima más fresco, la gente pasará más tiempo adentro y eso puede aumentar la propagación del COVID-19. También estamos cerca de los días festivos de Halloween, Día de los Muertos, Diwali, Acción de Gracias, Hanukkah, Navidad, Kwanzaa y Año Nuevo. Estos días festivos siempre están llenos de reuniones que no permiten el distanciamiento social. Pero como he dicho, hasta que no haya una vacuna confiable que esté disponible, debemos coexistir con COVID-19. Esto significa que tendremos que celebrar nuestras fiestas de manera un poco diferente. Para Halloween, pedir dulces podría implicar colocar dulces envueltos individualmente, espaciados, en una mesa donde los niños disfrazados pueden pasar. Las fiestas de disfraces para adultos en casa o en bares pueden aumentar su riesgo de contraer COVID-19 y propagarlo en la comunidad. Pero para cualquier persona que lleve un disfraz, sea niño o adulto, una máscara de disfraz no es un sustituto de una cubrecara. Las casas embrujadas no están permitidas en la fase 4, pero los bosques embrujados al aire libre o los paseos embrujadas se pueden hacer con distanciamiento social y las máscaras. Se permiten paseos en heno, pero solo con capacidad limitada y con distanciamiento social. También se permiten visitas rachos de calabazas y ajuertos con las máscaras y distanciamiento social. Estos son tiempos sin precedentes y tiempos muy difíciles para todos, pero animo a la gente a aceptar las diferencias y tratar de ser creativos en estas temporadas festivas. Por favor, sigue lavando las manos, observando las distancias y usando sus máscaras. Y es muy importante de vacunarse contra la gripe antes del final de octubre. Muchísimas gracias. And with that, I'll turn it back over to Governor Pritzker.
All right, we'll open it up to some questions. We'll start with one from KMOV in St. Louis. Governor, would you honor St. Clair County's request to be its own region as opposed to being part of Region 4?
Well, as you know, we've made sure that these regions have actually gotten smaller over time. We had 4 regions in the state of Illinois. We now have 11. They follow the regions, the health regions that are set out by the Department of Public Health. And, we're working very hard with the neighboring counties around St. Clair, but just to be clear, people travel in that region. They travel between counties. It is not a good idea, in my view, for us to break this down into 102 counties across the state of Illinois. But instead, if we can work with the counties and particularly their county public health officials to bring down their positivity rates, that is the right solution. So we're all doing that. I can very much appreciate the work that's been done in St. Clair County to bring down the positivity rate there. We're getting very close. We just need to work on the other counties in the region. We are doing that on a regular basis. And I very much appreciated the encouragement of the people in St. Clair County for those other counties to get on the ball and start moving those positivity rates down.
This question is from Amy Jacobson. We know you can't comment on pending litigation, but there's 355,000 high school athletes in the state who want to play all fall sports. Many of these young teens will be able to vote in 2022. Are you concerned about losing re-election?
Well, Amy, I think before asking that question that all of my decisions have been focused on what's good for the health and safety of the people of Illinois. There's been not a single one of my COVID-19 decisions that has been based on politics. And that will be the case until we can get past this pandemic. We ought to be relying upon the science, upon the doctors, upon the researchers. And I do believe that we're making progress in terms of the possibility of very effective treatments and, of course, the potential for a vaccine. But I'm not thinking about anything about politics or re-election when I make the decisions that I make. It's most important to me just to focus on, frankly, when I go to bed at night, I think about the many, many people that have died in this state, in this country. I think about what more I can do. And I think about how to make sure that we get through this without more people getting sick. So that's what I focus on.
This question is from Dylan. This is for Dr. Zike. Restaurants here in Rockford are feeling singled out by the new mitigations in Region 1. Can you talk about what the reasoning is behind the decision to close indoor dining while other businesses are allowed to stay open?
So we do have data that is starting to come in from our Salesforce platform, which is what the contact tracers use to put information into the system after they've talked to people who have been diagnosed with COVID-19. And so we have seen some of the common themes around where the possible exposures have been for these positive cases, individuals who have contracted COVID-19. And bars and restaurants restaurants do come up as a common exposure place. Of course, the number one exposure commonality that people have is their workplace, and we can't you can't stop people from going to work, so when we look at the things that we can actually intervene on, that is at the top of the list, bars and restaurants, in terms of exposures that people had that led to their infection, and what things that we can take action on that can give us a swift result. The goal isn't to punish bars and restaurants. The goal is to be able to get these numbers down so that we don't have rampant infection transmission throughout our community that makes everyone just that much more at risk.
This is from Karina Curry. Is there anything the state is doing or can further do to support businesses that are struggling under litigation?
Yes, and I want to address that. I just want to make another comment, which is there literally are a dozen studies that you can look at. They've been done from around the nation and around the world about bars and restaurants and the ease with which the virus is transmitted in those environments. So I just want to be clear, this isn't something that got made up somewhere. In fact, there's been a high focus on this, as you know, from very early on, but there's now a lot of data to support and a lot of studies to support the idea that bars and restaurants are particularly of concern in terms of transmission. In terms of the support for businesses across the state, I'm so glad you asked, because I've been focused on this since very early on in this pandemic. And we now have business interruption grants that the Department of Commerce and Economic Opportunity in my administration is offering. Indeed, there are webinars that you can join to learn about how to apply for and get those grants as soon as you can. If you go to either the web page for the Department of Commerce or to their Twitter feed, you'll find notices about those webinars, and I think that would be a great place for everyone to start if they haven't already applied. But it is vitally important that we do everything we can in the state with the resources that we have. Many of those resources, by the way, do come from the federal government, and we've made sure to allocate them properly, particularly to those that have been hardest hit and those that have been in communities that are most put upon by this virus and most susceptible. I guess I should add that we are, of course, looking to the federal government for more help for businesses in Illinois. I've been steadily, regularly seeking not only support for bars and restaurants from the federal government, but also for small businesses across the state. So we'll continue to do that. Unfortunately, the Republicans in the Senate have been holding up any progress on a new CARES Act, new support for small businesses, new support for states and local governments. But there's, always hope, and I'll continue to work hard to beat down the doors of those who can help us.
Craig Wall wants to know, Governor, what you think about the presidential debate last night.
It was a mess. That's what I can say. Look, I watched it, and I think there's a quote this morning from a voter in Pennsylvania who said that it was like trying to win an argument with a crackhead. That's what that debate seemed like last night. It was just, there were no rules. The moderator didn't have control of it. The president was all over the place and didn't live within any of the guidance that was given for debates. And as a result, frankly, I don't think the American public got much out of that debate. And as a result, I think that was a win for the guy who's ahead, and that's Vice President Joe Biden.
Craig Dellamore is asking, some municipalities and private entities have advertised haunted houses with some outdoor activities and promises of social distancing and appointments. Will these be prohibited, and are DPH officials reaching out to places like this to communicate the rules?
Well, we can't reach out to every establishment, but we certainly have made clear that the outdoor activities can be allowed, and that the problem is with indoor haunted houses, which tend to be very enclosed, not a lot of open space. And as a result, the viral load can get high very quickly in a space like that. So that's, I think, why the doctors chose to act as they did with regard to haunted houses.
Dan Petrella at the Tribune asks, as the president continues to raise questions about the validity of the vote in November, why should Illinoisans be confident in voting by mail during this pandemic?
Well, we've had vote by mail in Illinois for some number of years, and so there's I think, a reasonable high confidence level. People who have done it have done so successfully. We have not had situations of voter fraud in Illinois caused by vote by mail. And we've made special effort in the state, and I think you saw that I called upon the State Board of Elections to put out some of its HAVA funding to assist with drop boxes, so people who want to drop their ballot off in a drop box have something available to them in their county somewhere near where they live. So we've made voting, I think, easier and safer in Illinois, and we'll continue to focus on the security of the ballot in our state. We've focused on our cybersecurity. We've focused on the security of the vote by mail program. I think in Illinois, if I were a voter anywhere in this state, I would feel confident in the systems that we have.
Tony Arnold at WBEZ. Should Speaker Madigan testify before the House Special Investigating Committee? Why or why not?
Well, let me just say this, that I think it's incumbent upon all of us as elected leaders, as people who represent the people of Illinois, to work to restore public trust in government at every level. I think it's an important opportunity that this committee in the House to receive testimony, and it's an opportunity to get answers that I think the public deserves to get. And you've heard me talk about that in the past. And I strongly believe that the Speaker should take any opportunity, and this is one, to present answers to the questions that I think all of us have.
Dave Dahl is asking how confident you are about the graduated tax passing. 60% is more than even you got.
Well, what I can say is I'm confident that that this is best for the people of Illinois, that 97% of people are going to get a tax break. I'm confident that this makes the tax system fairer. I feel pretty good that it will pass. And I know that in terms of our fiscal footing in the state, that this puts us in a stronger position if we pass it. And it also, I think, in a moment when the wealthy president of the United States seems to have paid only $750 in taxes each year, that makes the point, I think, to everybody. Nurses and firefighters and teachers pay, an average $12,000 a year, sometimes more, to the federal government in taxes, and the president's paying $750. That doesn't seem right, and we need to make sure that the tax system in the state of Illinois is fair, and that the wealthiest people among us pay their fair share.
Ryan Boyles is asking, when does the state expect to receive its shipment of antigen tests from the federal government, and how does it plan to use them? How many total tests do you expect to receive from the feds?
So we expect to receive several million tests from the federal government. They'll be arriving sometime over the next, I believe they begin arriving over the next few days, and will be arriving, as I understand, over the next 2 weeks in total. And so we're very excited to be able to use these Binax Now tests, is what they're called, and believe that it helps us to build the testing that we already have. I feel good about where we are in terms of the PCR tests that we're issuing and the saliva tests. Now we'll have this new antigen test to use, and more testing is better. You've seen that, I think, at the University of Illinois, where they're testing twice a week, and it's been very effective.
Dorothy Tucker at WBBM. Will the governor amend the eviction moratorium to account for landlords who are homeless because their non-paying tenants with jobs can't be evicted?
We're looking at how we might amend the executive order around this. As you know, I've been trying to balance the interests of landlords and tenants. This is very difficult. The financial situation for everyone is become, for many people, devastating. And so, we want to make sure that the burden isn't just carried by one group of people, but we also want to make sure that we're providing as much support as we can for renters and for those who own their homes who have to pay their mortgages. And I think you've seen that we implemented in the state of Illinois the largest support program for renters and for mortgage holders to pay their rent and pay their mortgages. And I would like to be able to expand that program. And once again, I'm asking the federal government for their assistance in doing that.
This is from Rockford for Dr. Ezike. Representative Severson and Representative Stewart are asking her to come to Rockford to make herself available to answer questions in much more detail for what they call arbitrary decisions for mitigation. What do you say to that request?
No, I think I've tried to be as open and available as possible. We've initiated conversations with the legislators to keep them abreast of what was happening. I welcome continued dialogue to discuss these important issues.
And then this will be our last question. It's from Marnie Bank at the Daily Herald. Could you respond to President Trump encouraging his supporters to, quote, go to the polls and watch very carefully on Election Day? Do you have any concerns about voters being intimidated, and is there enough security planned for voters?
I have to say that I am concerned. I'm concerned when the president, can't call out white supremacists, can't call out the Proud Boys, and seems not to understand that he is undermining democracy with these kinds of remarks. Now, in terms of the state of Illinois, we're doing quite a lot to make sure that the polling places are secure. And of course, we're encouraging people to be election judges. We're encouraging people who want to be poll watchers. They're allowed to do that. It's very important for us to have these kinds of activities going on, but those who try to disrupt the vote, they will be held accountable for their actions, and we will not let that interfere with voting on Election Day or in the 45 days roughly before Election Day when people can early vote and send in their ballots.
All right, that's all the time we have for. Thank you everyone for joining us. We'll see you next week.